Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Welcome back to Policy and Rights here on Depictions Media. I am Michael, and today on November 18th, we still have large spikes of COVID-19 happening all over North America and South America. The Pan-American Health Organization is going to make comments about that. You have Dr. Barbosa with opening comments, and hopefully his words and the information that will be provided by this will inspire us to actually follow what our local health authorities are telling us about the protocols that we need to follow to keep the number of cases down. The real fear with this, of course, it comes in the way of, if we overwhelm the healthcare system, that is going to be the part that actually causes more deaths in extreme or acute cases, where people need to have the ventilators. They're going to start using up beds and things like that. It may not necessarily be the COVID-19 that starts causing spikes in deaths in our community. It may be other diseases that could be very well curable by a person just simply stopping in the ER, and then hours later they're sent back home again. But there are things that can happen in our community that with complications to diabetes, heart conditions, whatever, that if there aren't space because of COVID-19 cases, that other conditions become way more deadly in our community. So let's listen to what the folks at PAHO have to say, and we'll be back.
Costly. In fact, the latest projection from the COVAX facility from Latin America and the Caribbean estimated that vaccinating around 20% of the population will cost more than $2 billion. And while these figures are high, vaccines are both a smart and necessary investment. This is why PAHO has been working with member states to ensure that every country that is interested will have access to the COVAX facility. We have also partnered with the Inter-American Development Bank, the European Union, and other financial institutions and donors to secure the funding needed for lower-income countries in our region to join. Self-financing countries in the Americas participating in the COVAX facility will have the option to purchase the vaccines through PAHO's revolving fund. This will accelerate their access because they have been using this mechanism for many years and have already adapted their laws and regulations accordingly. As of today, 28 self-financing countries have signed agreements with the COVAX facility, and an additional 10 countries in the Americas are eligible for support under the COVAX Advanced Market Commitment. Because time is of the essence, many vaccine manufacturers have begun producing COVID-19 vaccines even before they receive regulatory approval. However, it is important to keep in mind that they can only be used once clinical trials are complete, data on the safety and efficacy has been published, and licensing received from regulatory authorities. Last week, PAHO and UNICEF kicked off the purchasing process for COVID-19 vaccines by inviting vaccine manufacturers around the world to apply to become a supplier for the 186 countries that have joined the COVAX facility. By the end of 2021, the facility aims to deploy at least 2 billion doses of quality COVID-19 vaccines quickly and equitably. This is a remarkable figure, but we also know that it won't be sufficient to vaccinate everyone, at least not at first. Our main goal, as we plan the first phase of vaccination, is to save lives. And that is why it is important to protect the most vulnerable first. We want to protect care workers and other frontline workers, as well as those at a high risk of developing severe disease. PAHO has worked closely with governments to review their immunization programs, share regulatory information, strengthen their cold chain capacity to ensure a smooth and quick rollout. Indeed, some of the vaccines being developed may require new ways to store, transport, and distribute vaccines with the region, and we will need to build on existing infrastructure to meet this challenge. Even with these efforts, we know that trust is the most important ingredient in a vaccination campaign. And as COVID-19 vaccines advance through the research process, we must remain vigilant against rumors and conspiracy theories spreading across our region that have the potential to disrupt vaccination efforts and impede our COVID response. We call on countries across our region to help build the trust needed for these upcoming vaccines by providing transparent, accurate information about the vaccine developing process, as well as its safety and efficacy. Above all, we must all stand up against misinformation, as these rumors have an impact on people's perception and attitudes toward a COVID-19 vaccine. This will not only waste valuable time and resources, but it will also cost lives. Although a COVID-19 vaccine is still some months away, and preparation for this is key, we must not forget to continue to implement those measures that we know will reduce the spread of the virus, control the transmission, and save lives. Wearing masks, maintaining physical distancing, avoiding unnecessary gatherings, and following the recommendations of local and national health authorities. Furthermore, we must make the most of the life-saving vaccines that are already available to prevent other outbreaks of severe diseases such as polio, measles, and others. Vaccination rates continue to fall in our region, and like other essential health services, have been further impacted by COVID-19 disruptions, with a decrease in demand for vaccination services. This year, 90 countries in the region of the Americas reported a total of 80,479 cases of measles, most of them imported cases from Europe, Africa, and Asia, including 8 deaths. And 5 countries reported 56 cases of diphtheria, including 16 deaths. Both of these diseases, for example, are fully preventable with vaccines. PAHO and WHO are also launching a global campaign this week to fight cervical cancer. HPV vaccines are safe and effective. This is an opportunity we can't waste. Vaccines should always be seen as a global public good. For decades, PAHO has been working to make vaccines affordable and available to all who need them. As we race towards a COVID-19 vaccine, we should not compromise this vision. Thank you.
Muchas gracias, Dr. Barbosa.
Thank you very much, Dr. Barbosa. Now we are going to move on to questions and answers. Please remember that you can send us your question through the Q&A button and also include your name and media
Pregunta que nos llegó
The
es
first question that we received is by Tim Nisler from CNN. He says,
vaccine trial results are reported. What is PAHO's view about how member states should approach procurement of the right vaccines? And should they avoid anything that requires ultra cold storage? Y también relacionado con esto nos preguntó Mariana Souquet de Efecto Cocuyo.
we also have a question from the journalist in Venezuela.
Be able to buy through COVAX and if Sputnik vaccine will be available. Dr. Barbosa?
Thank you for these questions. This is a decision that each country have to make. Of course, that is a sort of decision the region that have resources to do that. They are making bilateral agreements with individual producers. We do believe that the COVAX facility is the best option, the best alternative that we have to guarantee equitable access to safe and effective and affordable vaccines. Because COVAX facility will work with a basket of producers. As I mentioned on my initial statements, PAHO and UNICEF just released the first public call for producers. So in a couple of weeks, we will have official information about the prices, the cold chain requirements for each vaccine, the volume of vaccines, and the timeline that they can deploy. So this is very important for us because this will be the first time that the poorest countries in the world will receive the vaccine at the same time that the richest country in the world. And these vaccines that will be purchased through COVAX will be pre-qualified by WHO. So they will be vaccines that will receive a sort of assessment about their quality, the safety, and the efficacy. Thank you.
Gracias, doctor.
Thank you very
Siguiente
much,
pregunta.
Dr. Barbosa. The next question, I would like to give the word to Arturo Wallace from BBC News World. Arturo, you have the floor.
Muchas gracias. Buenas tardes de
Thank
Londres.
you very much. Good afternoon.
Yo quería
from
saber
London.
si ahí en la
know
OPS,
whether
digamos, identifican en la
PAHO
forma en que se ha producido esta llamada segunda ola de casos en Europa,
has identified even the
lecciones para la
second
región,
wave in Europe,
y qué
any
lecciones
lessons
serían
learned
esas
for
para
the
ante la
region,
inminencia tal
and
vez de
what
una segunda ola
those
en algunos
lessons
de esos
be
países
to avoid a
que,
second
como
wave
mencionó el
in
doctor
some
Barbosa,
of
digamos,
these
ahorita a lo
countries. And
mejor
as
están viendo
Dr.
una
Barbosa
reducción de
just
casos.
mentioned, some countries are already seeing a reduction in the number of cases. Thank you, Arturo.
Mismo, muy similar, nos preguntó
And
Mónica Pérez.
also, Mónica Pérez Marín from Channel 13 in Chile is also asking recommendations for the countries to avoid a second wave. Dr. Espinal? Thank you. Thank you both. I would like to thank Mónica and Arturo for their questions. The lesson is that we shouldn't lower our guard. The recommendation to avoid a second wave is clear. We need to balance the economic, social aspects together with public health, but at the same time maintain the measures. We will have a vaccine. We still don't have it. As Dr. Barbosa said, we have very encouraging preliminary data. We still do not have the vaccine, but we should not get desperate. We wouldn't like to see the second wave in Latin America. We have not finished with the first one, but based on the lessons learned, if we continue with the measures, if we continue with the educational programs in connection with the use of face masks, hand washing, social distancing, and more so now with the holidays, Christmas, it is important to prevent this virus. Has given rise to many deaths, as we all know, has caused many deaths. And Europe, where we have much more developed countries with the arrival of summer and the drop in the number of deaths, the measures also were decreased. Yes, it is understandable, but we need to introduce innovative measures. We have seen, for example, in the case of Chile, that they continue with the curfew in some areas. It has to do with community transmission. They do not need to implement curfew throughout the country, but if we need to resort to that. We need a combination of measures, from testing to contact tracing, contact in case identification, so that we can flatten the curve. We continue to see the same in Uruguay. They implemented those measures and they continue to implement those measures. We shouldn't lower the guard. We do not want a second wave as strong as the one that we had seen in Europe. And this is not something that we can disregard and that we can assure you that it's not going to happen. But if we maintain the measures, if we do not relax those measures, we continue to educate our population. You need to recall that it is more difficult here in Latin America because we have more crowding, we have non-urban areas that are not properly developed. So those measures have worked and they will help us. Thank you. Thank you, Doctor. The next question was sent by Mariana Garcia from Chronicle 1 in Venezuela. She is saying that we already know that in Venezuela we have the antigen tests available, but when are they going to be implemented? How many are going to be processed daily? And as of when are we going to see the number of positive cases reflected in the figures reported by the government? Dr. Ugarte. Thank you, Sebastian. Thank you, Mariana. As we had indicated a couple of weeks ago, between October 24th and November 7th, the tests were sent, the staff was trained, and all of the states within Venezuela do have installed capacity for this antigen test, and the test was implemented throughout the states. Most of the states that are using
SD biosensor tiene la capacidad de reportar electrónicamente de manera inmediata. Se procesan las muestras y de tal manera que ahora estamos trabajando con los otros estados que tienen equipos que se tiene que reportar manualmente, pero para poder facilitar el reporte electrónico al sistema de información de salud del país. Por lo tanto, ya se están procesando las muestras y se está enviando la información.
So we are sending that the information. The information is, so how many can be processed daily? The maximum capacity for each piece of equipment is 200 daily tests, but the capacity depends on the number of patients or the number of patients that do have symptoms that are compatible with COVID-19 and that are being sampled. So if we continue to consider the pace of cases that we have seen in previous months, we have enough number of tests. We have the minimum up to January next year, but there is a possibility to acquire more in the short term. As to the results and whether they would be reflected in positive cases, whether those positive cases would be reported in the numbers that are indicated by the number. The National Office of Epidemiology has indicated that the positive results from these antigen tests are already included in the mortality and morbidity cases reported by the government, and in this case there is no need to implement an additional PCR test because the protocol already includes the positive result based on this method. So this is data that is already being used, but the results in those cities that are implementing the test can be sent to the patient within a couple of hours, but there are other localities that are far from the areas where the test is being processed. In those cases, it may take a couple of days longer, but the response time has been increased. Thank you. Thank you, Dr. Ugarte. Now the next question was emailed to us by Adolfo Quicker, who is a journalist with the Republic in Peru. He is asking, what could PAHO say about the discovery of the Chaparral virus, as indicated by the CDC. Now that they have confirmed human transmission, it is a reason to be vigilant in Bolivia and also in the neighboring areas. Dr. Aldigueri. Good morning. Thank you very much for that question from Peru. We are referring to a series of epidemiological data from 2019, that is to say before the pandemic, and that succession of events took us to this announcement by the CDC together with other partners. This is mainly a warning so that we do not lower our guard in case of endemic diseases and emerging diseases. We heard about measles, polio. We also should mention dengue and malaria, but this is an emerging disease. The Chaparral virus is part of the New World arenavirus family, so this is something that circulates in the Americas, and this is part of several viruses that we have in this area, such as Machupo in the northern area of Bolivia, Junin in some areas of the Argentinian Pampas, Gonarito in the area of some areas of Venezuela. So I'd like to highlight two comments. First, the collaboration among several institutions and countries to characterize these outbreaks and new events and the human transmission. For example, the role of the Ministry of Health of Bolivia, as well as the Center for Tropical Diseases in Bolivia that is based in Santa Cruz de Tierra. This is a very high-level laboratory, and also CDC, that is a center that coordinates in the area of hemorrhagic fevers, and also the role of the Mastigi lab in Argentina for field characterization as part of this outbreak, and PAHO. So we have a set of partners that are working together to characterize and define these viruses, and they are working with very precise molecular tools such as the sequencing that led to the discovery of a variant of this virus that is known, Chaparral, but that is a different variant, and also the identification and clear identification of human to transmission, which was already suspected for other viruses within the same family. It is also important to highlight human transmission in hospital settings and health wards. So this also takes us to one of these messages that we have been using during the pandemic, that is the strict implementation of infection control measures within the health facilities, the use of personal protection equipment, including face masks, including hand washing, and including the cleaning of surfaces. So it is very important to respect these rules, which are very strict, and I hope I have addressed the question by our colleague from Peru.
Gracias, doctor. Tenemos varias preguntas.
We have several questions in chat pertaining to vaccines. Questions on possible mutation, on the safety of the vaccines, and the cold chain. Lara Pinheiro from G1 Global in Brazil asks,
heard of many new mutations on SARS-CoV-2. Can any of them so far interfere with vaccine development? Are there any new dangerous ones? And also Tanya Smith-Cartwright from the Bahamas, the Tribune newspaper, asks, when will COVID-19 vaccine reach the Bahamas shores? And given the short period of time scientists took to prepare it, how safe will it be? Doctor Barbosa, si podría contestar primero estas dos preguntas.
Thank you for this question. First, I think that in many other press briefings we are highlighting that all the existent viruses that we know, they can present small differences in their genetic information. This is what we expect for a virus. this new virus, I think that is one of the viruses that is under the more comprehensive surveillance system that we have had in many decades. We have now many thousands of genetic sequencing processes in many different countries. Yes, there are some differences, but as the scientists say, it's like the same person that is using a different hat or a different shirt. So far, we don't have any significant mutation in the virus that has increased or decreased their capacity to infect the people, that decrease or increase their capacity to produce severe cases. So, for instance, I know that there are some rumors about the second wave in Europe is related to a mutation in the virus. This is not true. The conditions in Europe that are related to the second wave are the same that we had before. It was open up the economies, people getting together in closed spaces, the summer, the travels, everything that was very well known. So the vaccine that have been developed, and we do believe that we will have a vaccine in the first semester of 2021 will be effective against COVID-19. Of course, that we will need to monitor this. It's a new virus, but almost every day we have new information about this genetic epidemiological characteristics of the virus. So yes, the vaccine will be effective against the virus with the information that we have so far. The second question about from Tanya Smith-Cartwright from Bahamas. Tanya, this is indeed, I think that a very rapid development process of vaccine. And this was possible because we are not facing a regular disease. We are facing the most challenging public health emergency in 1 century. So the efforts that hundreds of scientists, producers, academic institutions, biotech companies have been done is also a totally unprecedented effort. And many of this research also where they build on some development that had been made before for other coronavirus, such as the coronavirus that produced the SARS outbreak and the MERS outbreak. So this is important to highlight. Second, the public health emergency will not release all the requirements that the regulators, WHO, make for each vaccine. So they will need to prove not by a company information, but through publication of the scientific data, by the assessment of the regulators of the dossiers that each producer has to present. So a vaccine, when is considered ready to be used, and for PAHO, this vaccine will need to be approved by WHO. This vaccine will prove similarly as other vaccines that we have been using for many decades as a vaccine that is safe and is efficacious. So this is in summary, the process will be the same. Of course, it will be a more expedited process, but we will review very carefully all the data. And what is the specific date? Unfortunately, we don't have the first week of March or the last week of April, but probably during the first semester, we will have vaccines being deployed by the countries through the COVAX facility. Thank you.
Gracias, doctor. Me gustaría darle la palabra a Ricardo Braginski, periodista de Clarín de Argentina. Ricardo.
Now I have Ricardo Cravins from Clarín in Argentina who has a question. You have the floor, Ricardo. Ricardo? We are listening. You can ask your question.
Sí, buenos días. Simplemente conocer si hay algún estudio que correlacione la apertura de escuelas con casos nuevos de coronavirus en los países, si hay alguna relación. Muchas gracias.
That's my question. Thank you. Thank you, Ricardo. Dr. Espinal, could you respond to that question, please? Yes, thank you so much, Ricardo. Yes, we are beginning to see evidence of this. It is not definitive, but studies done in the Catalan area of Spain, for instance, have suggested that schools with children under the age of 12 are not strong transmitters. They're not super spreaders, as they say in English. And also evidence suggests that children under 10, 12 years of age don't transmit the disease very effectively. The cases that we have seen in schools have been determined to have come from outside the school. It was through a family or a community transmission. Also in the state of Utah in the United States, that has a very good database, has tried to correlate the cases in each district. And there they have observed that there is no correlation. In fact, it's negative. In other words, the schools do not contribute to transmission. Now, it's a combination of measures, because in a community where you have high levels of transmission, it may be better to wait a bit, have school be virtual until the contagion drops. We must require the use of masks by teachers, hand washing, and all the measures that the schools are using disinfecting gels, etc. However, in other countries such as Vietnam and Zambia, they have reopened their schools and they have not seen an increase in transmission. Now, we still need more evidence, more facts, but it seems to be that schools are not transmitters. Let me go to the other extreme. You also have to keep in mind that the problem of doing virtual education on kids, it has effects of their mental health. We have seen extreme weight gain, obesity, other problems, because they're isolated and the parents have to become the teachers. So you have to balance that too. But the evidence does seem to indicate that there is no higher transmission in schools with children under 12. Now, in older age children with adolescents, yes, there is. They can transmit to adults, and you have to be more careful. Thank you, Doctor. Let me go to Lidia Lopez from La Prensa in Nicaragua. Lidia, if you are listening, you have the floor. Lidia.
Hola, ¿sí?
Do you hear me? Yes.
¿Me escuchan? Ok, sí, tengo dos preguntas. La primera es, ¿qué acciones específicas deberían realizar las autoridades de salud para atender a la población afectada por el huracán Iota? Esto, pues, tomando en cuenta que hay hacinamiento en los albergues, donde carecen de agua y alimentos, ¿no? Y pues donde no se puede tomar estas medidas de prevención como es el lavado de manos. Y la segunda es, ¿se han podido conversar con las autoridades de salud de Nicaragua a propósito de esta emergencia que ha dejado Iota, ¿no? Y pues si la OPS tiene planes de apoyo para el sector salud que atiende a esta población afectada. Muchas gracias.
Does PAHO have any health plans for the health sector to support them during this crisis? Dr. Parte, could you please respond? Thank you, Lydia. To begin with, our solidarity and our condolences to the people of Nicaragua, because we know there have been 10 deaths reported, 4 of them in a very big landslide. 1,000 meters of longitude and 200 meters width. There have been persons who have disappeared, and right now their multi-institutional teams are dealing with that crisis. Yesterday they also reported another 6 deaths. And I'd like to mention that although the conditions are extremely difficult, particularly in the shelters, it is necessary to guarantee access to water, food, shelter, of course, and in these areas there is the need to implement the needs for water and sanitation. In fact, it's in those areas that we're working with the government authorities and the UN to ensure that in the shelters and places where populations have been affected, though at least those needs are met. Right now, there is very serious difficulty in accessing certain areas, and the damage assessment will probably take place in the next few hours, perhaps even days. What is affecting Nicaragua is also now affecting other Central American countries, as we've mentioned. But in the specific case of Nicaragua, the support we have provided has been sending PPE and materials for dealing with COVID patients, but we're also mobilizing other resources, including providing technical support to be able to respond to the 2 hurricanes and others. And we're also mobilizing resources that allow the essential health services to provide continuity. Right now, we're also planning a specific project to provide water and sanitation to the affected populations. The damage in the other countries is also extensive. We mentioned that the status report of PAHOs indicate that there's been severe damage in the islands of San Andres and Providencia. The hospital in Providencia has been severely damaged. The reports indicate it's actually been destroyed, and it's the only health establishment in that island. There's also been severe damage to other countries. There are more than 156 deaths, hundreds of disappeared persons, and the rain is still continuing. So we will be working also with Honduras, Guatemala, El Salvador, and we are hoping that when the storm passes, we will be able to help you recover as quickly as possible. I apologize for speaking so much at length, but I'd also like to mention the increase in COVID cases. That has not yet been detected right now, but it's highly likely that they will increase over the next few weeks, because it always takes some time from transmission to the cases to appear. Thank you, Doctor. The next question came from Valeria Heredia in El Comercio in Ecuador, and she asks, when will the antigen tests reach Ecuador, and how many will we have? And what is your recommendation for the use in patients? Dr. Aldieri? Thank you for Ecuador's question. The rapid antigen tests is a priority for PAHO, because that's very important in our response. The antigen detection tests have already reached Ecuador. They're in the process of delivering it to INSPI. The Public Health Institute will be coordinating it with the laboratories. The PAHO team based in Ecuador and at the regional level has already done training with the Ministry of Public Health, so for the use of those tests, and we're planning to mobilize a PAHO expert to go, and the CDC to go to Ecuador at the beginning of December to help with the implementation in the field of the first phase of the use of those tests. They're also envisaging using those rapid antigen detection tests in the more remote areas, in the coastal areas, provinces, and in the mountain provinces. Keep in mind that the use of rapid antigen detection tests is recommended for symptomatic patients who have clinical signs suspicious signs of having COVID-19. And it's the most important aspect that those rapid antigen detection tests do not replace the use of the PCR test, which is the gold standard for a diagnosis. It allows for the expansion at the level of primary care in remote areas and can also help in alleviating the burden for laboratory services when there are a lot of patients who need to have a test done. Thank you. I hope I answered Ecuador's question. Thank you. Thank you, Doctor. Now, I'd like to call on Melina Ochoa from Uno TV in Mexico City. Melina, if you're listening, you have the floor.
¿Qué tal? ¿Me escuchan?
Do you hear me? Yes, go ahead.
Perfecto. Muy buenos días a todos. Pues ya como lo comentaba al inicio el subdirector Jarbas Barbosa, México rebasó el 1,000,000 de contagios. Preguntar, ¿cuándo podría registrarse un segundo pico de la epidemia coronavirus en México? Y bueno, si justamente esta temporada invernal ayudaría a que las condiciones se dieran y hubiese un segundo pico. Gracias.
And lead to a second peak spike. Thank you, Melina. Dr. Barbosa, can you respond, please? Yes, thank you, Melina. This image of waves of the disease are interesting because they're based on the epidemiological curve of a disease. So, for instance, in Europe and in New York, we physically had a first wave because it grew, the cases peaked very quickly. They exhausted their contention measures and then the cases dropped. Now, after there were some months that went by with almost no cases. France, Spain, Italy had a number of cases and deaths that were very low during the summer. Now, with the opening up of the economy and travel, etc., it'll begin to spike upward again. So that's why you talk about a second wave. In Latin America, the situation is different. Most of the countries until today have not been able to control transmission. It was decreasing in some countries, and very often that happens because countries such as Mexico, Argentina, Brazil, Peru have provinces or states that are more committed, and so it stops decreasing one state but begins to increase in another state. But when you look at the whole average for the country, it's as if they were still in the first wave, but a very long wave, because they never yet controlled it. Now, given that process, yes, it is possible to have a second outbreak. That is, a state that was having a downward spiral is now beginning to see an upswing. That's why we have emphasized that the health authorities not only need to look at the progress of the country, but see what is happening in each state, province, municipality, because that if they identify that transmission is surging in one city or state, they have to take the appropriate measures that we know can work to reduce the spread of the disease. So yes, it is possible in any part of the world where the virus is present. If conditions allow for transmission will increase and we will see more cases and more deaths. Thank you, Doctor. The next question comes to us through email, and it says,
to curbing the spread of the virus, how effective have lockdowns been around the world? Dr. Espinal?
Thank you very much for the question. I think the issue is not only to centralize the response in one action. Lockdowns are part of a package of actions, and all of them contribute. The response to this pandemic is not entirely one specific action. Lockdowns, if we see what happened in Australia, in Melbourne, for instance, in the state of Victoria, critically the lockdown worked.
And we have seen what happened in Chile, also in Uruguay, joined with other actions. It's a package. It's about 9 pillars. PAHO recommend 9 pillars to the country. And you don't have to, we don't have to talk about total lockdowns because we know there is fatigue. But if there is high community transmission, a partial curfew or a few hours of stay at home, this might work. This work. But of course, we have to combine with social distance, with education, with hand washing, with testing availability to all the population, and trace contacts and so on. So we should not try to say lockdown is one side or the only solution because as we said from the very beginning, a virus that has been with us for a year now, or next month a year, if we take the first few cases in China, we don't have the answers to everything yet. But we still don't have the vaccines, although Dr. Barbosa mentioned the preliminary good data and so on. So we need to do our best to ensure that rainbow of actions are in place. And lockdowns is part of it. It doesn't have to be for a long time, but it could help. If it's limited, it's partial, always coupled with the other actions. Thank you.
Muchas gracias, doctor.
Thank you, doctor.
Elisha George, de Newsco Limited en Antigua. Dice, what are the requirements to store the Pfizer vaccine? And will Antigua and Barbuda be required to build a special storage facility for the vaccine? Dr. Barbosa?
Thank you for this question. Many questions about this vaccine, and indeed we understand. But let me tell you, we have 11 vaccines that are in the final phase of clinical trial, phase 3. Pfizer today announced that they have completed the phase 3. Now they will publish the data first, they will present their data to the regulators and pre-qualification WHO team, etc. The Pfizer vaccine is the only vaccine that will require a different cold chain to storage the vaccine, because this vaccine needs to be kept in minus 70 Celsius degree. It's around, if I'm not mistaken, 103 Fahrenheit degrees. So it's a challenge for the countries that are thinking to purchase these vaccines from Pfizer. They will need to buy also new freezers to store these vaccines, because the cold chain that all countries now have, not only in Latin America and the Caribbean, but worldwide, they don't have this kind of freezers. They are available in the market for a country that has limited, that has a small population. Maybe they can purchase a certain number of these freezers. In COVAX facility, our priority is to have vaccines that are affordable and that can be used with the existing cold chain. So the countries will not have to spend additional resources and more time to purchase or to build new facilities. But again, this is a decision that each country needs to make based on the data, based on the availability of resources, in order to make the best option. PAHO, of course, is supporting them, providing all the information that we have. But the countries that are thinking to buy the Pfizer vaccine, they will need also to see the costs and the time that will require to have these changes and improvement in their cold chain.
Gracias, doctor. Voy con las últimas preguntas.
Doctor, let me go to the last questions for which we will have time to respond today's session. This one comes from Isabel Santos in Amazonia Real, Brazil agency. And it's related to the second wave, given the situation in Manaus.
WHO PAHO considers to say that a city is in a second wave of COVID-19. And also, how does WHO rate the current situation in the Brazilian city of Manaus? Dr. Espinal?
Thank you for those questions. Dr. Barbosa alluded to that, the issue of the curve. We need to follow the curve very carefully. But at the same time, the curve is a result of the surveillance system. If we have a good surveillance system, detection and a good tracing program of contacts to identify cases and isolate them, then we can detect second spikes or third spikes or wave. So it is important that the recommendations continue to be implemented or strengthened in the case of testing availability and surveillance system to ensure the cases are detected. In the case of Manaus, we have been seeing in the last few days increases in hospitalization, increases in cases, and increases in mortality. So the recommendation is, as we always said, don't let the guards down. We need to continue strengthening our surveillance systems, our information to the country, to the population, and to use the actions that social distance, again, hand washing, education to the population, and always using languages and adapted to the population. We must remember that there's an important indigenous populations in Manaus also, so we need to talk and also make sure that we respect their behavior, their practices, but we also inform them. And information is really important, and let us not forget to ensure that we fight the misinformation and the fake news, because that could also bring more problems than solutions. Over. Thank you.
Gracias, doctor. Y la última pregunta.
Thank you, doctor. And the last question, which we can take today, is from Barbara Fraser, a journalist in Peru. She says,
outbreak. Have diphtheria cases been reported in other Latin American countries? Is there any evidence that it could have been exported from Venezuela? And also, what surveillance steps are recommended to detect this disease or others that could appear because of low vaccination rate? Dr. Barbosa?
Thank you for this question. This is a very important question, because sometimes we do believe that it's enough to have a vaccine that the disease is automatically eliminated, and that is not true. And now we have, not only in Peru, but also in other 4 countries in Latin America, we have diphtheria cases. We have these 5 countries have reported a total of 56 confirmed cases, including 16 deaths. Brazil has 2 cases, Dominican Republic 3 cases, Haiti 42 cases, Peru 4 cases. In Venezuela, 5 confirmed cases. I think that the important thing is not to think about from where these cases come from. The important thing is to strengthen the surveillance system in order to detect the cases very rapidly and to take the proper measures to contain the outbreak, and also to review the immunization coverage in each country, because even if a person comes from another country, if the local population is vaccinated, they are protected. So let's not try to find the external problems. We need to review very carefully each state, each province, each city, neighborhood, how are the immunization coverage levels. This is the answer to be protected from any vaccine-preventable diseases. Another example is measles. We have many cases of measles in our region this year. Most of them imported cases from Europe, from Africa, from Asia. We have only in Brazil an outbreak that is still active the Ministry of Health of Brazil is working very hard with the states and municipalities in order to close, to finalize this outbreak, to control this outbreak. So it's very important that every country in the region needs to strengthen their surveillance system, and they needed to review very carefully the data that they have about the immunization coverage, and develop a specific strategy to reach out that people that still need to be vaccinated. This is the only way that we have to prevent these outbreaks to happen and other of severe diseases that can be prevented by vaccines. Our region has in our countries we have strong immunization programs that have been working for many years, and now they have this additional challenge that was posed by COVID-19 pandemic. Many services need to be temporarily suspended, temporarily closed, and now this is the time that we need to highlight the importance to keep the public health priority programs, and immunization is one of the most important, running and guaranteeing the access of the families and the communities to the vaccines. Thank you.
Muchas gracias, doctor Barbosa. Ahora sí, entonces hemos llegado al final de la sesión de hoy. Vamos a compartirles en el chat la página web de la OPS y también pueden...
Thank you very much, Dr. Barbosa. We have come to the end of our session.
Okay, so there's still a lot of talk about the vaccine. Of course, we have heard that there are vaccines out there that are over 90% effective as a medical treatment, and that we still need to follow the protocols until the vaccine is out. We still will need to follow the protocols until the pandemic has been settled and there are no longer large spikes in the system for COVID-19. With that, I want to thank everybody for listening, and please do find and follow us wherever that you get your podcasting from, and we will talk to you later. Thank you for listening to Policy and Rights here on Depictions Media, and I'm Michael. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.